Epic, the leading healthcare software in the United States, just announced that they're developing their own ERP software. But what is Healthcare ERP, and how does Epic stack up against other leaders in ERP technology? Today, we'll answer those questions and break down our top 3 ERP systems for healthcare in 2025 and beyond. Epic manages over 55% of the nation's hospital beds, specifically controlling the clinical bedside operations. Like most EHR, electronic health record software, Epic focuses on clinical documentation, patient medical records, and electronic prescribing. It even supports medical billing and revenue cycle management through its Resolute platform. But Epic and other EHRs aren't designed to manage the back office and operational sides very well. Things like supply chain management, finances, inventory control, and workforce management like payroll and scheduling are all handled by outside siloed software systems. Epic is trying to solve this, and many of the systems on our list are already working towards it. First on the list, we have one of the top names in enterprise software, Oracle Health. Oracle Health is a complete ERP and EHR software formerly known as Cerner. Before Oracle's acquisition of it a few years ago, Cerner was a standalone EHR product competing against Epic. But since the purchase, Oracle has been aggressively integrating its enterprise software expertise with healthcare-specific functionality, expanding its feature set beyond just clinical workflows. Today, Oracle Health brings financials, procurement, employee workforce planning, and advanced analytics to the same environment as patient care systems. One standout feature is its revenue cycle automation, which handles complex claims processes across multiple facilities and payer types. It includes built-in tools to flag underpayments, automate claim details, and accelerate reimbursement processes. For networks that manage Medicare, Medicaid, and private insurance, that level of control is important to get right every time. Data visibility is another strength of Oracle Health, especially for executives who need quick, reliable reporting to guide decisions. The Analytics Suite can draw from both clinical and operational data to create live dashboards for each department's performance. Think about key metrics like the number of open beds per floor or the time from patient intake to discharge. But this type of power comes with complexity. This is not a system for small organizations and can take over a year to properly implement for larger hospitals. Pricing for Oracle Health, along with the other ERPs on our list, often requires custom quotes. To get accurate pricing along with free tailored walkthroughs of the system, reach out to us in the description below or head over to softwareconnect.com. But if you need a platform to handle both EHR and ERP capabilities from one provider, Oracle is one of the best platforms you can implement today. The next system on our list is a platform that doesn't need its own EHR to compete. While Oracle entered the field through acquisitions, Infor Cloud Suite Healthcare has been focusing on solving healthcare's operational challenges from the ground up. Infor Healthcare is a cloud-based ERP for hospitals and integrated delivery networks with major providers like St. Vincent Health and HCA Healthcare using it. Infor leans on its years of experience in the distribution and manufacturing industries to support strong supply chain management and inventory management, finance, and workforce efficiency. And while it doesn't include its own native EHR, it syncs cleanly with leading clinical platforms like Oracle Health and Epicor right out of the gates. Infor's biggest strength is its supply chain automation. Instead of relying on separate tools for managing inventory and procurement, Infor connects directly with vendors and distributors to automate restocking. It can also track expiration dates on supplies and monitor inventory levels. A recent update to the Infor's Enterprise AI platform gives caretakers like RNs and CNAs voice-assisted inventory lookup. With this add-on enabled, you can ask where something is, and the software will tell you, automatically remove it from inventory, and start the reordering process if stock is low. And like Oracle Health, Infor is built for scale. It's best for large organizations with the budget and staff to support a full rollout. While it can be somewhat simpler to implement than Oracle, small facilities or specialty clinics will find it more than they need. And the last ERP on our list is, of course, Epic ERP. While we know the system is still under development, it's definitely a system we need to include. As they announced at the 2025 HIMSS conference, Epic is already ramping up the production of the HR, finance, and supply chain management modules to work alongside their clinical ecosystems. The full ERP suite is still in early development and will first focus on features that are most important to its partners. And some of the early rollouts have already been promising, like Epic's new staff scheduling tools and AI agents that help automate lab test coordination, manage prescription refills, and improve communications between patients and clinicians. That said, Epic's ERP offering is still very new and not widely available, and pricing details remain unclear. Even the CEO, Junie Faulkner, recently stated that there's no set timeline when Epic ERP will be officially offered as a completed product. But if Epic can deliver on its vision, it could become the most tightly integrated ERP and EHR platform on the market. So which system should you choose? If you want a fully integrated ERP and EHR platform, then you'll have to wait until Epic is done developing its system, or adopt Epic as your EHR and hopefully get the chance to become an early test dummy for their ERP. But if you don't want to wait, you can't go wrong with either Oracle Health or Infor. Oracle is best for larger health network organizations with over 700 beds, especially those already using the Cerner ecosystem or needing advanced RCM tools or reporting. Infor Cloud Suite Healthcare is best for organizations with 250 to 1,000 beds that already have an EHR and need a platform to better manage their supply chain and employee schedules. And obviously, these aren't the only systems available to the healthcare industry. If you're a specialty clinic or a smaller health chain with an existing EHR but need more advanced accounting than QuickBooks offers, then a system like Multiview is more up your alley. You can check out all the systems we discussed today, including Multiview, on our breakdown of the best healthcare platforms. If you want to explore healthcare technology more deeply, we're also working on breakdowns and videos on the best medical billing and practice management software. So check those out below. And of course, knowing what's out there is only half the battle. Choosing the right one for your organization is where things get tricky. At Software Connect, we help hospitals and clinics find the right ERP and get you accurate price quotes based on your specific structure, complexity, and budget. The best part, our recommendations are personalized and completely free. Use the link in the description or head over to softwareconnect.com to get started. And before you go, let us know in the comments, what are your biggest challenges when you're looking for an ERP or healthcare software? Or are there two systems you wish we would compare in a future video? We'd love to hear from you. Thanks for watching and sticking around to the end. Please like the video and subscribe.